Good afternoon and welcome back to another episode of A Warrior's Journey to Recovery. Today we are here with Matt and Angelina. How you guys doing today?
Doing
Good.
good. Glad to be here.
Glad to have you guys. So today we're going to talk a little bit about Matt and his journey to recovery, obviously. Can you tell us a little bit about your time in the service and what it was like?
Yeah, so I was in the Air Force from 2004 to 2008. I was lucky enough to go to Italy for 2 years, and then I came to Tucson for 2 years.
Okay. And what was your time in the service like?
It was a good time. You have a lot of camaraderie with friends. You enjoy the traveling. You get to meet so many new people.
hmm
It's a whole different experience, versus living as a civilian life. But I guess I was only 18 when I went in, so I kind of didn't know either way.
Right? That makes sense. Still young. Okay. Did you ever have any sort of injuries while you were in the military?
Yeah, so I actually had a motorcycle accident, and I guess I hit my head, but I didn't know at the time it was a brain injury. So I went years and years, and I can get into that later on what happened, how I figured that all out. But mainly the motorcycle accident, and then sometimes you just have head injuries and you don't even know about as a child, and they come up on these brain scans later down the road.
Oh yeah, we hear about that all the time, especially as you're older. The issues really start to make themselves known.
Yeah, and the symptoms come, and then they click together, and you're like, oh, I got to get that checked out.
Yeah, like what is that? So can you tell me a little bit about what it was like when you got out of the service, when you came home?
Yeah, so it's definitely a hard experience because you're going from this life where you have orders, everyone's telling you what to do, you're always around people, which
hmm
is a good thing. You're happy, you're doing stuff, you're doing your job. And then you get out and everything just stops. So you're like, what do I do now? You hit this wall.
Yeah.
And then if you're suffering from, some mental illness or anything, even physical illness, chronic pain or, PTSD, as a lot of veterans do, it's really hard. Then you got the GI Bill, so you're like, do I want to go to school? Do I want to work? And it's just this balance trying to figure out how you get to this normal life.
Right.
Yeah, and it was hard. It took a while, but I feel like moving forward, you just learn and go with it day by day.
Fair. Angelina,
What's up? What do you want to know?
were you guys together while he was in the service, or did that come after?
We met right at the end. So we met when Matt was already being, what do you call it? There's an official name.
Discharged?
You were being discharged. Yeah, we met. I think he was still wearing like the weird boots, and I was like, why is he dressing like that? And I guess in the military, the guys all wear that, and I am civilian. Like, I was a typical civilian. I don't even know like the rankings. I know nothing. So I met him at the end of it. Yeah,
Okay.
to answer your question.
And what was he like when you first met him?
Well, super handsome. That was the first thing.
Oh yeah.
And but he was really quiet. When I met him, he didn't. I'm an extrovert, and I'm like really loud.
You're social?
Yeah, you can see facial expressions in my face, and I'm talking loud, and I'm approaching people. And Matt was just really quiet. Just went in, and I was working in a real estate office, and so I got to meet him just passively. And the more that I met, like the more that I would kind of bump into him or see him, the more he was like trusting of me.
Yeah.
And then he would start asking questions, and I'm like, oh, this guy's kind of cool.
Right.
Totally opposite of what I was as far as personality. He wasn't flat. It wasn't like a flat affect. He was just quiet, just easygoing.
Mm-hmm.
Yeah. And I think when they say opposites attract, I think that really is it, because I was a mess, and he just was like really put together.
Yeah, I can imagine just getting out of the military. I mean, you still had, brought all that with you. Very orderly, put together. Things had a time and a place.
Yeah, exactly. And you always had to pay your bills on time and stuff like that.
But
Or your sergeant's going to come and knock on your door, huh?
Yep.
But did you feel like you were put together? Like, or were you, because I know your personality now, like now knowing you, I wonder now back then, I'm curious, were you really that put together?
Well, not as much as you would think. So, the with the mental illness and brain injury and all that, it gets worse the less you treat it. So the
Right.
longer you have it, you get worse and worse. So back then I was, doing okay.
Mhm.
And as each year would get worse and year after would get worse. And we try to find solutions and nothing happened.
That's right.
So it was a struggle. But when I first met her, yeah, I was doing much better.
Mhm.
But we it was before Matt's struggles. I think it was I think you were struggling with something or no? Like you were kind of not I don't know how to say it, but I feel like it was the beginning of a journey, of a long journey.
Yeah, it's when I started noticing I had depression and I kind of hid it. I didn't want anyone to know. You get out of the service, you're a guy, you don't want to have mental problems. What's wrong with
Yeah,
you,
you
you
don't
know?
wanna say nothing to nobody.
And then you don't want to go to the VA. Then it's on your record, and you're like,
Yeah.
no, I don't want people knowing. So I went and paid money to this private psychiatrist because I tried hiding it, and he
Uh-huh.
gave me these medications, endless list of medications, and he's like, well, let's try some more medications. So it's just back and forth, and you feel worse. You got side effects. You're trying all these things. So that went on,
And then you
you
gotta
know.
treat those side effects with a new medication, right? So
Yeah,
it's
like a
just like an
substance,
ongoing
alcohol.
rotating door that you guys get kinda stuck in.
Exactly. Yeah. Yeah.
Um, so kind of a deeper question here. Do you feel like that could be the reason as to why 22 veterans a day are committing suicide because there's just not enough help? Or, like you said, as a guy, you don't want to admit to having depression. Like, do you think that being afraid to reach out for help could potentially be like why a lot of these guys are making that decision? Or what do you think brings them to that point in their life?
Yeah, it's a tough question to answer. Personally, I guess I could say isolation for me. You get out of the service, you're around all these people, and then you start isolating. You don't know what to do. Then you
Mhm.
start getting your thoughts, and then it just compounds, becoming worse and worse. And then yeah, the stigma with mental illness, the vets, if they have a stigma, I mean, it's hard. It's hard for them to come forward. They could have traumas, and once they do come forward, they can notice. It can get a lot easier. There are people to help them. Sometimes, as a vet, you maybe like, no one's gonna help me. Everyone's against me. But
Mhm.
if you do start searching, there will be people out there. There's services that help vets. Some people talk bad about the VA, but they're a good starting place.
Yeah.
Yeah.
Absolutely. I mean, at least, you know, someone to talk to that can, point you in the right direction. And if that's not the direction you want to go in, at least you had it, like you said, a starting point.
Mhm.
Yeah, and I mean, if someone out there is, suicidal, I would definitely recommend calling the number, the VA number. Get in touch with someone. Just call someone. Just let someone know how you're feeling. Because if you're isolated and you're thinking that in your head, no one's there to tell you you're wrong. Tell you to
Absolutely.
stop. So you gotta contact someone. Just make it be known. Just get the process started. Because there are treatments out there that are gonna help you.
Right. So, Angelina, can you tell me a little bit about what that was like for you, watching him go through this struggle?
Yeah, so in the beginning I didn't know what was going on. And I'm sure Matt will get into the timeline of all these ups and downs. And um, I think in the beginning, I just wanted to help him, whatever it is that it was, because I guess how many years ago was that?
That was 2008, the
So
beginning. But it got worse. 2010,
yeah,
11, 12.
yeah, because I'm trying to think of how people thought about depression back then. I think now we're a little bit more open. I
Right.
hope, and I hope so, and I hope that wives are listening, and I hope parents are listening, even children, adult children, if it's appropriate. But I think at the time it just seemed like Matt was trying to figure himself out as far. It looked like a career goal, looked like just personal goals, and he was just like not sitting right here in Tucson, like where we live.
Right.
And so it just appeared like he wanted to go back. He wanted to live in another state, and so I was very supportive of that. And I kind of was like, well, I'm his girlfriend. This is, whatever's best for him. We're really enjoying the time that we have together, but understand if he needs to move on. So I was just like really supportive
Yeah.
of him, and but it got really hard, eventually, because no matter where he would go, he was still struggling,
Right.
And coming out of the service, and I I'm sure they drink a lot. I hear it and I know it and I saw it. And so a lot of times you think, well, maybe it's just the drinking. You want to just kind of isolate the problem.
Right.
And then I was the one that would say things like, "Oh, well, you just have to have a better attitude, or you just have to think more positive, right? Because I'm, happy-go-lucky, like totally, not in the service, living the life of freedom, no, no rules." So my lifestyle was different at the time, so I was in a better place than he was, obviously, and I didn't have any, traumas that.
Yeah.
I mean, now we can. That's
I
a
feel
whole
like
nother
it's
lecture.
I feel like as a wife, it's kind of hard to, understand what they're going through if you've never really experienced it yourself. And being on the outside when they don't want to, really let you in and tell you how they're feeling because as a man, like you said, it is kind of a stigma. Like you don't want to tell somebody that you're feeling some kind of way because then all of a sudden like your man card's taken away.
And sometimes you don't know what you're feeling. You just don't feel you're hurting or you're not sure why and you just want to kind of tweak something and hope that maybe that will make you feel better.
Mhm.
And if I'm, talking to the wives and everybody's yeah, sometimes there's something wrong, but it might, you know, there's you don't know the answer.
Yeah.
And it's okay. And so we went down that journey. He didn't give up, so then I wasn't going to give up. And but yeah, I mean, I don't know how much in detail or how much time we have, but it was tough. In the beginning, it was just like supportive, obviously saying all the wrong things, not knowing, not having done the research because we didn't know what was going on,
Yeah.
um, yeah, there was the typical like just drinking alcohol, trying to maybe like, party and I would kind of go along with it in the beginning. And then it got to a point where I'm like, I'm not really, no, I'm not
I don't wanna
feeling
do this
this.
anymore.
Yeah,
Yeah.
I don't want to go there.
Yeah.
But he was still hurting.
Yeah,
He would,
there's the self-medicating, like she was saying, the alcohol and the trips. She was saying we would go places. We would just like leave somewhere just to try to mask the problem. But wherever you go, the problem's coming with you. So that ain't
yeah,
gonna work. I mean, you gotta sit down and figure out what you got going on
yeah.
because
Absolutely. That's
trying to
really
get out of
important.
state, yeah, it's gonna come with you wherever
Like,
you
yeah,
goes.
we would take these trips or we would go for a hike. I remember this one time he was really not feeling well and he was like, "We're going to go for a hike." And I was like, "Okay, let's go for a hike." And it was just like he was just trying to shake something off.
Mhm.
Yeah.
Um,
So a lot of these times, when I was feeling horrible, I would just get these impulsive ideas. Just I gotta do something crazy because I don't want to be in my brain. It's so hard being in that brain. So I'm gonna do anything, whatever it takes. So we went and tried to climb a mountain. Almost ran out of water. It
yeah,
Oh
was
man.
yeah,
yeah,
we were this close from calling like 911 for a helicopter.
Especially in Arizona, you don't
Yeah.
want to run out of water
Yeah.
here.
yeah,
And I'm like, I really don't want to go up any further. Nope, we're going up. And I'm like, oh, I can't let him go by himself. So many times that I did let him go by himself to do something and I completely regretted it. And I'm like, oh man.
Maybe I should have
But
done that. Yeah.
but we did things that I was there with him while he was trying to shake off whatever it was. And I think some people, like you said, they use substances to try to, just not feel whatever it is that they're feeling, just to numb it out, even just for a little bit.
Yep.
And I think that was very quickly I figured that out with Matt. And I remember there was this one time he was trying to leave town and the word depression never came up. It was always like, I just don't feel right. But what I did notice was a severe, severe isolation. Like, no, when he was not feeling well, it was like there was no communication with parents, with family, with siblings, with friends. I remember he excommunicated like a lot of his military friends and I'm like, "Oh, well, they're drinking and he's trying not to drink. Maybe it's a good thing." But yeah, it wasn't there was a lot of isolation and I think it's important if someone's that normally calls you and you're worried about them, you might want to
Reach
check
out.
in and they may not answer. You may need to go a little further because they're really trying to hide away and they're not doing it. It's not personal against anyone. They're hurting
Yeah.
somewhere.
Hurting and lost.
yeah.
So go ahead.
And it's hard finding that the diagnosis. She said I didn't say the word depression, which was true because I mean at the beginning I don't even think I knew what it was,
Yeah.
and then years down the road, doctors are saying it's depression, and then I go and get this brain scan because I'm like kind of obsessed with Dr. Amen. I don't know if you guys heard of him, but
Mhm.
he does the brain scans and he has like the most brain scans in the world, the SPECT, high definition. So he looks at the football players scans, children's scans, and his nephew, I believe, had a tumor that they
Mhm.
misdiagnosed that he had ADHD. So he never had ADHD, he just had a tumor and he found it in the brain scan.
Mhm.
So he fell in love with the brain scans, and I decided to go ahead and do that. It was a very expensive scan, but I saved up for years and years. And I was like, I'm gonna do it. So I go and do this brain scan. I'm like, oh, he's gonna tell me about my depression or my anxiety. He's gonna look at this part of the brain and say, oh, you got something wrong with your prefrontal cortex. Excuse me. But he's actually like, you got a brain injury, and I'm like, whoa, I don't have a brain injury. It just doesn't make sense. How do I have a brain injury? Because of the motorcycle accident, no one told me I had a brain injury.
Yeah.
They did an MRI and they said my brain was fine. So I come out and I'm like kind of in denial for like 6 months or a year. And I think you asked me a question earlier about how did I, determine what to do next. So with the brain scan, I noticed they talked about hyperbaric oxygen. And so like 6 months or a year later, I was doing the research. How do I do this?
Mhm.
And North Star popped up, and I was like, "Oh, I'm gonna give them a call." So North Star, that was the introduction to North Star, and I realized they had Healing Arizona. They help veterans, they get them treated, and they have lots of different benefits and some medication changes, supplements. So that's how I got started with them.
Awesome. So going to Dr. Amen's clinic, and having that brain scan is kind of what made you want to do more research into what had happened. And so that's what led you to us at North Star, correct?
Yeah, that's correct. And it was an eye-opening experience just to hear the words TBI, mild TBI, because you think TBI, these people are in the hospital or they can't speak properly,
Mhm.
very severe. And no, it's just mild to moderate. But you're like, okay, if it's just mild and I'm speaking properly, I'm not having, too many cognitive dysfunction or anything like that.
Right.
But there's still all these symptoms that I thought it was just depression.
Mhm.
But the depression could have been a symptom from the TBI itself
Absolutely.
the whole time. And it took me years and years of antidepressants to find out I don't need antidepressants.
Yeah.
They make it worse, actually.
So when you came to North Star, did Dr. Henricks, obviously she did the initial consult with you, but did she have you go do the brain MRI DTI with the neuroquant at Simon Med?
Yeah, so that's something that is very beneficial as well. That she does the MRI DTI, because a lot of doctors just do an MRI when you have a brain injury, or they think you have a brain injury, and it just shows up normal. But when you do the DTI, you actually see the details of the neurons. They're not firing. How much damage you have, the left side of your brain, the rear, the front, wherever it's at, and you can see all that with the MRI that Dr. Hendricks orders. And mine was pretty bad. you know, she was like, "Yeah, this is pretty severe. We need to get it treated."
Mhm.
And that was the first step there.
So how did you feel seeing his MRI DTI when you came in?
And it was really a relief that we were going in the right direction.
Mhm.
And Matt, when you look at Matt, he looks like a healthy human being.
Right.
Physically, he's not like he's brilliant when it comes to like his work. There's a lot of things that he was super, like he's just a normal human being. Like for the definition, it's wrong now to think of it that way. If someone's hurting, there's also issues with the brain. And he was always looking for a cure. And I don't know if, people that are struggling right now, they're trying to find an answer. So we finally got the answer. And we knew it was going to be in a journey. We knew it wasn't like, oh, this is it. No, it was just finally something gave in. Finally, someone was pointing us in the right direction. Because, the medications that he was taking, they had, he didn't respond well. And he behaved in ways that were not okay. They were unsafe. And this was all doctors do what they can. Doctors are still learning, and it's not their fault that they don't, they prescribe a medication, but you as a patient also need to go and give feedback and tell them, well, you know, I didn't feel right when you did this. Well, Matt had a lot of that going on. So when we realized he's having all these, let's call them psychiatric issues, but we were actually dealing with like a neurology, like the brain. It wasn't a psych issue, it was the brain.
Yeah.
And that just opens up my whole like awareness about mental health now.
Right.
But yeah, to answer your question, it was such a relief to finally have someone treat him in a way that was actually going to work, instead of just like, oh, depression, you're going to be right here, we're going to try this, and none of it was working.
Just slap
Yeah.
another diagnosis and another pill on top of your already 10 diagnoses that you've probably been given in the past.
Yeah, and you're on the antidepressants, and people with TBIs, they can become manic, not because they're bipolar, just because the brain is imbalanced. So I would get on these antidepressants and, kind of just show these manic behaviors and just go do weird stuff, go, stay out late or go drinking more than I normally would. So you experience all these side effects from these antidepressants, and you realize, you just can't take them. They're not working. They're not either not meant for me. And then once I got that brain scan, the MRI DTI to back it up, I tell my doctor, so it makes sense, and we adjusted there a lot of the medications. This was before doing all the hyperbaric. So I was, somewhat better coming off the antidepressants, having awareness of the brain injury.
So, and when you came to North Star, you also met with Dr. Marshall, right?
Yeah, so that was great. He does the natural medicine. I mean, if you need to stay on your medications, he's okay with that. He'll add it, he'll tweak it. The goal is to get off them if you can, but everyone's different. It all depends on how many treatments you do in the hyperbaric. Everyone's situation is different, but it definitely opened up my eyes more into the natural world. Instead of you don't have to take a medication.
Right. Yeah, there's not, I don't want to say always, there's always a supplement to fix something that you're suffering from, but there's I mean, there is a use for pharmaceuticals, obviously. But I feel, when it comes to being nutrient deficient, your body's not going to function at maximum, functionality anyway. So when you start taking, these supplements, obviously you have to do the blood work first to kind of find out where you're at. But I feel like once you start taking those things and getting yourself, like you said, more balanced, it can probably help to, ease a lot of the issues that you were already dealing with.
Yeah, absolutely. And I just have to say, like, a lot of people may be listening, they think they don't have a brain injury, but they have some psych problems. A lot of people have brain injuries. They don't even realize that you could have them as kids. You could fall off a horse. You don't even have to hit anything, and you can get a brain injury just from whiplash.
Or
So,
even weren't we talking about like how the shearing, like PTSD can cause shearing. So so let's say for the vets that went out and they experience traumatic things, right? Something that may not traumatize one person may traumatize the other. So you can't have this, and so let's say they experience trauma that causes the shearing of the brain, right? And so this is coming up on the scan. So just because you didn't remember smacking your head or whatever, falling off a bike or, or having a car accident, it doesn't mean that you're not brain injured.
Yeah, just the
Absolutely.
explosions and the loud noise, from the bombs that can cause the shearing as well.
Well, I mean, even if you're sitting there shooting the 50 cal, I mean, the blast impact from that alone can cause post-concussion syndrome. So, and if you're doing that on a daily basis, if you're artillery in the, let's say the Army, and that's your job is to shoot the 50 cal on a daily basis, like the blast impact from that is causing, shaking of the brain, which is causing an injury each time you're using it. So,
Yeah.
And you're right. Like a lot of people don't realize that, but like you said, the brain responds to trauma the same way, whether it's emotional or physical. It can cause some type of injury either way. It can destroy the pathways, your neurons stop firing correctly. So there's a lot that goes into a brain injury other than just, falling and smacking your head. So,
I have to tell you a really quick story. There was one time I was waiting for Matt outside of North Star. There was a Starbucks there, and there was a vet, and you can tell he was like, there was something about him. He was really, really intense. I don't think he was acting manic, but he had like tattoos that he was a vet, and I was waiting for my coffee, and he approaches me very, very like, oh my gosh, how do I call it? Intense.
Yeah.
And so in my mind, I'm thinking, he might be a vet, right? So I kind of, and he just started talking to me, and I said, I'm actually waiting for my husband. He's across North Star. They treat brain injured vets. And I'm looking at him like I'm waiting for him to say something. He says, oh, I'm a vet, but I'm not brain injured. I have really bad PTSD. And I realized that he was minimizing the trauma that he had experienced. So he thought, and I'm assuming like, okay, so he saw some of his buddies, lose their lives, lose a limb, or experience the impact of whatever's happening over there. But he's saying, well, no, I didn't experience a physical harm, and so I'm fine.
Right.
But right, Matt, like we've done research about shearing, and trauma does cause shearing of the brain, and that's a brain injury.
Absolutely.
And so for those vets that are thinking, no, I'm not brain injured, but you're having psychiatric issues, why don't you go find out? Like, why don't you dig in a little bit? And it's going to be such a relief to talk to a neurologist about your brain versus having experimenting with these things that you're doing, whether it's alcohol and substances and bad adult behavior, and harming your relationship with your loved ones. Go find out what's going on with my brain. Could it be? And they're going to show you a physical picture, and if there's nothing wrong with it, it's going to show right there.
Right.
Yeah.
Yep. It's
Yeah,
always
that's a great point.
It's a good route to take too. I mean, if nothing else, at least you'll know. You'll, like you said earlier, you'll at least have an answer and kind of, be able to go from there to figure out, okay, well, what's next?
Mm-hmm.
So, once you, did your MRI and you met with Dr. Marshall, you started HBOT. So tell me a little bit about your journey with the HBOT. Like how did it feel when you first started? What things did you notice? And then, maybe go into a little bit about like how you're feeling now after completing it.
Okay, yeah. So with Dr. Marshall, you get started on the natural vitamins, and then you start the treatments. So, you're kind of just like, what's going to happen next? How fast is it? How many treatments? And it's different for everybody. But I think a lot of people, whatever you have inside you is going to come out, because with the hyperbaric oxygen, at 1.5 ATA, so it's getting to your brain, it's getting to all your organs, all your skin and everything. So anything that's inside you, good or bad, is going to come out of you. So if you have some brain problems or some suicidal thoughts before, unfortunately, they might come out. So you just have to be prepared for that, because it's going to get everything out of you while you're healing the brain. In the whole process, going through the chamber, you're healing the brain each day. So you have to be aware of the fact that your brain is getting all that extra oxygen. You're going to be more, at least for me, it kind of made the depression go away. So I was a little more excited,
Mm-hmm.
not quite manic, but like more energetic slowly. But in the beginning, I would say the first 10 to 15, I had fatigue, which,
Yeah.
you're healing the brain. So that's going to happen. That's normal. And, the more you go through, I feel like you can reduce your medication, and then the vitamins that Dr. Tim was prescribing started working more.
Right.
Because before I did take, natural vitamins, and they just weren't strong enough because my brain was injured. So I needed like, powerful lithium and high dose anticonvulsants. And, that made sense because my brain was so injured, it wasn't working properly. So as my brain is continuing to heal, I'm reducing the medication. I'm still trying to figure out the proper dose, but, I'm a lot better. I can cope now. By the way, I did 150. That's probably way more than most people need. I'm so blessed and thankful that Healing Arizona and Dr. Hendricks and the staff and Mondo and you guys all helped me. It was a blessing. But after 150, I can cope now. That's the biggest thing. Before, you have a problem, as a brain injury, mild, severe, doesn't matter. You have something come at you. You have a problem from your wife, you have a problem at work, you have just something basic. It blows up. It
Right.
expands in your brain and you just cannot handle the processing of it. So now I have problems left, right, sideways. I can handle them better. I can take them and I can go make a proper decision. I'm not as impulsive. Information that comes to me, my brain, can process it much faster. And I have proof of this through the brain scan. You look at my before and after MRI DTI, and it's fascinating.
Right.
It's
Very different.
irrefutable. It's on paper.
Yeah.
So, I mean, if you didn't have that, but the fact that you have that on top of feeling better, coping, you're not perfect. You still need therapy, but you have the ability to go to therapy and understand now
Yeah. Better
something you.
quality of life for sure.
Yeah, absolutely.
And I think that's like, our biggest goal at North Star is making sure that you guys have a better quality of life. There's so many guys that come to us that are just incredibly lost. And, coming through our door is the first step. And I think the hardest step for a lot of guys coming through that front door, finally admitting, like, hey, I need help. But the thing about North Star is we act more as a ministry more than we do like a medical clinic. You guys come through our door and instantly become family to us. We care about you. We care about your well-being. Dr. Henricks loves every one of you guys that comes in. And, she looks at all of the vets that have come to her as children. Um, and, this is her baby that, she started this because she knew that there wasn't enough help out there. And
Mhm.
she knows that brain injuries are something that just goes so undiagnosed all the time. Um, and I think it's a beautiful thing watching, you guys come to us and being a part of your story in a sense, because I get to witness it all, all the all the things that happen in the beginning, when you first get there, you don't want to talk. You don't want to talk to me like, who is a strange girl at the front desk, asking me these questions. And then by the end, you're walking through my door and I don't want to say we're best friends, obviously, but it's like we've known each other a lifetime and you've only been there for what, 2 months? And you're just a completely different person. And I've had the pleasure of, getting to meet your wife and develop a relationship with her. I've met your children. So I think North Star, for, like you said, anyone who's maybe thinking about coming there, it's not your typical doctor's appointment. You come in our doors and you are welcomed by everybody, as well as having, military veterans that are operating the chamber. So you have that brotherhood again when you come back. You're not left to figure it out on your own.
Yeah.
What was that like for you? Coming in and getting to experience something so different. Like, how did you feel about that?
Oh, it's great because you actually you kind of miss the military, you miss the camaraderie ship when you leave, and you go years, and all of a sudden North Star comes up, and you go back in there and you meet these vets, you're hanging out with them, you're healing your brain with them, you're talking to you up front, and you're right, you don't, no one wants to talk to you in the beginning because they're
Nope.
brain injured, they're like, who is this girl? And or anybody, you don't even want to talk to the vets in the beginning.
I mean, you're
Sometimes
not
you're just like,
in the beginning. You're not feeling good. You're
Not at
like
all.
you're at the end of the road, like hoping this
Might
works,
work.
but like you're kind of like, well, what if it doesn't?
yeah, and
So
you're coming out of isolation by yourself, so then you get to this group, and then you guys are treating together. Then you're like, "Hey, how many treatments did you do? How are you feeling?" "Oh, I did 10. I'm still struggling, but I'm getting better." And then you got another vet, or just even a regular person in there to talk to as well. It's beneficial, and you get that feeling back to stop isolating. You heal together, you grow together, you talk to these people. They become like family, and it's great. And there's so many benefits just going to North Star compared. It's not going to a regular doctor. Completely different. It's a whole facility set up for healing and growth.
And after you started doing the treatments at North Star, you started doing some jujitsu, right, with one of the vets there?
Yeah, yeah. So they offer that, as a side. Mondo, he's great at that, and they're always trying to, have extra activities. Sometimes they have, massage therapy, or hiking. They
Yoga.
just yeah, yoga. They just really want to expand you beyond. Once you heal your brain, you have to go do something. Now that you have a new brain, it's like you had a messed up brain for 10, 15 years. So
Right.
now you got to live with this new brain. You have to get out. You have to maybe do your therapy. Some CBT, cognitive therapy is great. And just be active around other people, and it's all part of the growing process.
Absolutely. So, what was it like for you, Angelina, watching him grow and change over the course of doing these treatments? I mean, I can imagine in the beginning, you probably felt the same way as he did, kind of like, okay, is this actually going to work? Like,
Hmm.
I mean, is this real? Is this real? Because so many people think like it's too good to be true. There's no way that this is actually going to work. So
Hmm.
how did you feel, in the beginning, and then
So in the beginning, he was struggling, right? And so if there's any wives listening, parents listening, so the struggle at home is, we're dealing with a lot of stuff too. We're just trying to hold it down, be the one that it grounds everyone, grounds everything. And I think that, yeah, in the beginning, I was like, well, at least he's doing something healthy. And so we're going, so yeah, I was like, okay. He said, I'm gonna be going, it's gonna be a busy schedule. This is gonna be my schedule. This is what it's like. And he was very private about it too, because, that's just the mental health aspect of it.
right?
I didn't always go, but as he started going, and then I started seeing you guys and meeting you guys. But Matt said in the beginning he was struggling, because it intensifies things, right? So you're in this chamber, and you're coming out, and he looked exhausted. He would go home and he would sleep, and he would just like, just get ready for the next session. But there were, in the middle of that where he's struggling. I remember, he was with his friends, and Matt would not laugh. He would kind of smile, but I would be cracking up over something, and he was just like not laughing and just flat. And that was depression. Um, but there was this one time where I just saw him chuckle, and I didn't make him laugh. His friend made him laugh, and he just like chuckled, and I'm like, I could not remember the last time that he chuckled. And the only change that occurred was that he was doing HBOT. And I thought, it's working. Like if that is the only thing that he gains back out of this HBOT, it's so worth it.
Right.
Um, but if we fast track, I mean, you guys were also not, don't fast track yet. I just want to say you guys were there for us. So Dr. Marshall was there. Um, Cynthia was there for us. And like when I had questions and when I was struggling with him or whatever it was, when I was like worried about him, I would just kind of call. I would sometimes, inappropriately just show up and say, "Hey, so is this normal?"
Like,
You
help
know?
me.
Yeah. And the thing is that I was getting feedback from people that, had been there. And so then I was able to be reassured, like, yes, this is normal. Just wait till you see this. And so they gave me like some hope and also some milestones to see you guys grow. The other thing that was great was meeting other vets. So yes, there's a chamber. You're in the chamber with other people, and some of them may not want to talk. If you don't want to talk, you don't need to talk. But it was so fun to see them exchange, like, oh, how many sessions do you have? And oh, what part of your brain is injured? And so you
Right.
kind of talk about, and I feel like they genuinely want to know. And so, like he said, it was this friendship and of people struggling through the same thing and being supported by other people. So when, Matt wasn't feeling strong enough, there were other people there that would just help out.
Yeah, kind of pick
And
him back up.
yeah. But you said earlier quality of life. So today quality of life is better, and HBOT allowed Matt to be in a better place. So if you can imagine depression, anxiety, for people that are struggling with like anger and impulsivity or bad thoughts, that kind of stuff. It's a very selfish environment. You're by yourself and you're just trying to survive. You're just trying to make it to the next day. Um, but when you start, like Matt said, healing your brain, you have this new brain, then you're able to do other things to help you go forward, like, grow in your spirituality, be able to accomplish maybe career goals, physical goals, or maintain a healthy relationship so that you can move forward. So it's like a piece of the puzzle to be
Right.
able to grab everything else that you want
And put
and,
it all together.
yeah, like actually problem solve instead of being in your own shell, just hurting all the time.
Yeah.
And that's, yeah, so for now, quality of life is better because we had that HBOT, that piece of the puzzle in our life.
I think for me, like watching you guys come in, in the very beginning, knowing that you're hurting and seeing, like you said, they're kind of in that shell. Like, I think for me, that is the hardest part of my job, because I want nothing more than to see you guys flourish and feel better and come in with a smile, and when you first come in, I don't, typically I'm the bad guy. I'm that person at the front desk that they're just like, look, excuse my language, but fuck you. I don't want to talk to you. Like, don't ask me questions. I don't want to give you my information,
Mhm.
and then like, I just want to hug them. Like, don't be angry at me. Like, I just,
It's going to be okay.
yeah, it's going to be okay. Like, and I know I can't say like, I promise you this is good. Like, you're going to be okay. Like, but I'm there, to see them through to the end. And, I tell each and every one of our vets, like, you guys, man or woman, like, you are not in this alone. There are so many of us there to like walk you through this journey. Like, you don't ever have to travel this road by yourself. My personal phone number's on the back of my business card. So if someone's in crisis, like, they can call me night or day and say, please help me. That's literally what I'm there for. I never did have Matt call me. There was never a time where he was in crisis where he felt that he needed to call me and reach out. But
Not
there was,
surprised.
but there were so many times that like I got to see you. You would come in, you would talk to me, and like I would kind of find out what was going on, and it was kind of nostalgic to kind of be a part of that and like watch you guys grow back together as a couple as well, if that makes sense.
Yeah, we were struggling.
you're
Yeah, for those people that are like, maybe they already split up. Maybe there are relationships that have broken, and you're not sure what your vet, whether you're a female or a male vet, it doesn't matter. If your relationships are struggling, like just know Matt and I are back together. We have our daughter. We're working on our careers. We problem solve. We fight all the time. We have our differences all the time, but we're able to, like I said, problem solve. Like, we are able to cope. Okay, I'm angry, but our whole world's not falling apart.
right.
So our brains are able to make these connections, right? So your frontal lobe, the back of the head, the sides, and obviously there's, proper terminology for that. But every single part of your brain is able to communicate properly. There isn't like a dead end somewhere where this is where
Yeah.
it's not firing
It's
there.
like the
and I
stop
need
sign. We're
that.
just done. We're not going any
Yeah.
further.
Yeah. And for some of those vets, some of them are so brain injured that they're dealing with like a physical disability,
Yeah,
eyesight
absolutely.
issues, hearing issues, equilibrium issues. But yeah,
Yeah,
things
and the
are,
great thing about North Star, they have PEMF, pulse electronic magnetic therapy, I believe it's called.
Yeah,
And
pulsed
she was talking,
electromagnetic therapy.
yeah, oh my
about the
gosh.
physical pain. I mean, a lot of these vets have chronic pain, and you can go in right after you do a hyperbaric oxygen session and get this magnetic therapy. And I mean, 10 minutes, your pain starts going down, and you can do that every day. And then on top of that, you can use it on your brain. They actually have it approved for TMS. It's not North Star with TMS, but it's the same type of treatment, magnetic. And I put it on my brain, and I just feel amazing. I mean, everyone's going to be different, but it calms me down. It balances me. I have my proper thoughts.
Right.
It's like you can also stimulate the cells that just happened in the hyperbaric, so it's more beneficial right after the treatment.
So yeah, so something that we haven't really discussed on the show is the stem cell growth that is caused by doing hyperbaric treatments, as well as the PEMF. So like you just said, the PEMF actually helps to reduce inflammation in the body. It helps to break down like damaged cells and help the new cells that you've just created in the chamber. once it's breaking down those damaged cells, those cells that you just created by doing a hyperbaric session can then really go to work in the body and do what they need to do, in an area where there may be damage, whether it be the brain or, your knees or whatever. So the PEMF, always has to be done after the hyperbaric sessions, so that, they don't, uh, I guess, butt heads with each other. I can't think of the word I'm trying to use right now. But you do HBOT, then you do PEMF, and like you said, if you put it on your head, obviously it's got to be at a low frequency. You don't want to zap your poor brain too hard, but it does help, with kind of balancing everything out, and those damaged cells are kind of like just going away, and those new cells are coming in. And what the oxygen does, or the chamber does, is it actually allows your body to carry 7 times the amount of oxygen that you normally carry on a daily basis, like in just one cell. So rather than having, one blood cell with 1 oxygen, you now have 1 blood cell with, 7 times the amount of oxygen. So then your body can really take all of those blood cells that are highly oxygenated and send them to areas where there's just a lot of damage, which is really beneficial. And that's why we see so many, people make such a turnaround and get so much better.
Yeah, and there's nothing else really out there that is proven to heal the brain in this sort of way where you can see it on an MRI. I mean, there's some studies for infrared therapy, but it's not as powerful as the hyperbaric. Just the amount of oxygen you can get in that chamber, in the cells that are firing. I mean, I can tell after I did some sessions and my cells were on fire, my brain, I could feel it. It
Right.
was getting all that stuff out there. So there's not a lot of other options.
Yeah.
Maybe they're gonna give you medications, but why do you want medications when you can do this, a natural way?
Yeah. Well, medications a lot of times, band-aid the problem. They don't really fix the problem.
Mhm.
If there was a magic pill out there that just could heal damage, like, let's do it, but right
Mhm.
now hyperbarics is
Mhm.
like real. I mean, if you think about it, hyperbarics, they usually use it for wound care or, burns, somebody who's been severely burned.
Scuba
Well,
divers,
yeah, scuba divers who have what is it, the bends? Is that what they call it?
when they came up too
Yeah,
quickly from
and
their
they get the
dive, yeah.
bubbles. So hyperbarics has been used for that for forever. Well, if you think about a burn, it's a wound, right?
Mhm.
Well, your brain is a tissue, and it's
Mhm.
all of a sudden like you have, this TBI, you've got an injury to the brain. Well, your brain's a tissue, so is your leg where you're burned, right?
Mhm.
So if hyperbaric treatments are going to heal the wound on your leg, then why wouldn't they heal the wound in your brain?
Mhm.
A lot of people don't really think about that. So just think about your brain has a wound, and you're using wound healing treatment modalities to
Mhm.
heal that, just like you would if you actually had a burn on your leg and you went to the burn unit and they put you in the hyperbaric
Yeah.
chamber.
And then like, and if you're listening, like, sure, Google. If you want to Google and you want to get a reputable, look for peer-reviewed journals. There are articles out there that will show you that it is working. And you have to ask yourself, why isn't it already like mainstream? Why isn't everybody doing it? They are in other countries, but
Right.
Yeah,
yeah,
Israel's number one,
yeah,
and China's doing it, like they, all their
yeah,
residents do it. It's
yeah,
definitely ahead of times.
and it will become a thing, and if you're not feeling well, do it now. It's here, it's
Absolutely.
at North Star, and it's just a matter of time for you know I and it's crazy, but some people were flying in from out of state,
Yep.
so to be able to get it. And I think like Tucson, North Stars might be the only one in Tucson right now.
Yes.
But what I'm trying to say is, if you don't believe us, go research it. Even with the magnetic, what is it called? PMF?
Yeah.
Yeah, PMF. Yeah, there's a lot
PMF?
of studies on that as well.
Yeah.
One of the books that they can also get too, be ordered on Amazon, is The Oxygen Revolution, the 3rd edition. It's written by Dr. Harch.
Yeah.
He also runs a clinic in New Orleans, and he is actually the author of the book. It's the book that we hand out
Mhm.
to a lot of our vets when they come in, so that they can become more aware of what the treatment does and how it helps,
Mhm.
as well as maybe, well, a lot of the times their wives end up reading it,
Mhm.
because they're not interested in reading. But
No, they're not feeling good.
yeah,
That's not. They're
exactly.
not in their right
So
mind.
a lot of
Yeah.
the times the wives will read it and then they come to us and they're just like, oh my gosh, like I just read this book. Like is
Mhm.
this what this is going to do for him?
Mhm.
So definitely I would recommend getting that book if anyone is, curious about what hyperbaric treatments are, how they can help, or if they're just like uncertain.
Yeah, Oxygen Revolution, I didn't start reading it until the end because in the
Hmm.
beginning I didn't feel good, and then the
Right.
end I started feeling better, so I started reading, and that book, is amazing. It opens up your mind. You're like, it is real. This is what happens when you have a brain injury and oxygen, and you can treat it. Another great book is Change Your Brain, Change Your Life by Daniel Amen. He talks a lot about hyperbaric in there and in the brain, and it's so fascinating. Once you learn it, you'll be more open to saying, okay, maybe I do have a brain injury and it's causing depression or anxiety or whatever, these symptoms that you don't want to talk about, but now you can go ahead and talk about it.
Mhm.
And talking about, Angelina and that veteran, or she said didn't have a brain injury. Angelina, my wife, actually has a brain injury to a minor degree.
Mhm.
We went and did a brain scan just for fun because
Hmm.
we know we can do it.
Well,
We could
not
do the MRI DTI, and she ended up having a mild shearing in the back of her
Mhm.
head, in the left of her head, I believe.
Mhm.
And so she did some treatments. And in the back part of the head, what Dr. Hendricks said, I believe, was, go ahead, you can tell him there's a problem with your processing
Yeah, I
or.
was processing information. So because it benefited Matt and I was having my own symptoms, obviously we had a lot going on and Matt says, why don't you get in the chamber? And I'm like, oh, well, I guess I could,
Right.
right? And the same questions, well, I'm not brain injured. Why would I do that?
Yeah.
And so Matt says, okay, and this is outside, Healing Arizona Vets. This is just us. Like, okay, let's see. I went to Dr. Hendricks and I said, Dr. Hendricks, I want to know my baseline, and I want to know, and I'm was going through nursing school through all that. I'm a nurse now, and so I want to know what my brain looks like, and yeah, I struggle with some stuff, and so the brain, the images come back and she's like, do you have trouble, with XYZ? And I'm like, yes, I
And she's
struggled
like, were you ever
so
in a
much.
car wreck or anything? And you're like, well, I was.
Yeah, because you get into these accidents, you get into these, car accidents, or even just playing, let's say, playing sports, and you just, smack your head. Well, we just think it's like, oh, kids are resilient.
He'll be fine.
Yeah, and
Yeah.
then as an adult, I also had a couple car accidents, and so we did the image, and it was confirmed. I had some shearing in the back of my head, and I told my mom, I said, Mom, I had this image done, and she says, oh yeah, there was this one time you had a horrible fall,
Oh.
and she, like, right? There are things you don't know that happen through your childhood. And like Matt grew up playing sports, he
Hmm.
football and soccer, and you get hit.
Absolutely,
And so
especially in soccer.
and here we are,
Hmm.
we just dust ourselves off and we just proceed, and then we're having these, as adults, we're struggling with these things, and you look and you're like, well, that student, is doing great. Why am I struggling so much? I'm trying. I'm doing it at 150% effort.
Right.
And how come I can't have it? Do I have a learning disability? What's going on here? And so when she gave me this feedback, Matt and I decided, yeah, we're going to do this hyperbaric oxygen. I'm going to invest in the schedule, right? Meaning go into North Star, get in the chamber, we figured out the schedule, we figured out the budget for it, and so I got to experience the tank from the inside, which is really awesome. And I did experience a lot of changes, like just like able to, how do I explain it? So like when you would give me instructions, so like let's say you would give me complex instructions, and
Hmm.
and we're talking about the back of the brain. So for all you doctors or whoever, you guys can tell me later what that is, but it was the back of the brain. So you would give me information, and I could not. It would just get really jumbled up,
Yeah.
and so I had to be the one be like, oh, let me write it down. I gotta write it down because I would forget it. I was not able to process it. It was like my brain was just hitting a wall. And so I really did struggle through nursing school. And if my peers would see me, they would just be like, she's the one that would try really, really, really hard and still barely made it.
Mhm.
And so I think
But I'm proud of you for sticking it through, girl.
yeah.
Like, you did it. You
Yeah.
are now a nurse.
Yeah.
So,
Yeah. And for those, even the vets, even if you're not, if you're not injured um in combat, or maybe and you're still struggling with these things, and maybe you did have a car accident or a sports injury, when you go into the emergency room, you're either seen in a trauma, and like in a traumatic, you go into trauma, or you go in and you wait for a nurse to take care of you. And the doctors there, which are great, by the way, where I work, they are the most intelligent people. They are brilliant, and they're, I mean, I don't know, I appreciate them very much. But you go in and there's a protocol. There is a system, and there is a checklist of things to do. Doing an MRI DTI is not part of it. Okay, you go into the emergency room and they're trying to make sure that you're stable.
right.
Okay, you're alive, you're not bleeding out, you're breathing. Okay, all right. And so then you're discharged. Either, hopefully you're discharged and you're not in the ICU. Okay,
Yeah.
but let's say you did, but eventually you go home. Okay, the ER doctors are not going to be able to follow up on you. That's not their specialty.
Right.
You need to follow up. You are your own advocate. Even when you are at the hospital or at a clinic, you can't expect a doctor to know everything. They
Exactly.
know as much as you're willing to divulge and you're willing to tell them. So you need to keep your own notes of what these are my concerns, these are my symptoms, this is a timeline, this is when I started this medication, I stopped this medication here, this was a reaction. Like, keep a journal. You're your own advocate. What I'm trying to say is, just because you go to the emergency room and you are brain injured, they're not going to be able to tell you there. They're going to be able to tell you have a life-threatening brain bleed. For patients who've suffered a stroke, that's a
Right.
brain injury. They're going to be able to tell you, okay, you had a stroke. But that's it. You got to follow up with a
Absolutely.
specialist, with your primary, with your therapist.
And we at North Star also have treated many people who've had strokes and had
Mm-hmm.
great success. So let's just throw that out
Mm-hmm.
there.
Yeah. And if you, I've asked a couple of the ER doctors, do you know what an MRI DTI is? And they look at me and because their specialty right now is different.
Yeah.
And so you are the one struggling. You have a responsibility, and your family, you can talk to your family to help you out, to say, okay, my primary physician doesn't understand what I'm talking about. So then let's get another opinion and keep digging. Don't give up. You're dealing with something, you're hurting, and so keep going. If when you get to North Star, it is a brain issue, which most everything is a brain issue. You're gonna be able to have an option,
Right.
And when you talk about homeopathic medicine, like, the United States is amazing. Like, this is, so many people come here, and I'm a first generation immigrant. Medicine here is so advanced, right?
Right.
But there's also ancient medicine, right? And there's a natural way of doing things.
Mm-hmm.
And you can just team up with everybody. You got your doctor who studied at one of the best universities. You have your neurologist, you have Dr. Marshall, you have your vitamins, your supplements, your medication.
Right.
You don't just stop your medication just because you feel like it. No, you got to do it with a professional.
Absolutely.
Yeah.
So, there was something that we had talked about a little bit ago. I'm still curious. Matt told me earlier that he couldn't hear out of his ear, and I want to know what happened and why.
Sure. So that was
I can tell them.
the worst, the worst of the worst. After dozens of medications,
Mhm.
after multiple ECT sessions, after ketamine infusions professionally.
Right.
Ketamine is another topic for another podcast,
Okay.
but it is out there to help, rapid antidepressant effects.
Right.
So I was drinking, I got a DUI, and I've always been suicidal from the beginning because the medication just never worked.
Right.
So it just got worse and worse, and I felt hopeless. There's no way out. So you drink, the medications, all this stuff, nothing works. So you get to the point of no return. You say, I did everything. I'm ready to go. So, I ended up hanging myself, and I fractured my skull.
Mm-hmm.
And my wife, she found me. I was unconscious for a little bit, and fracturing my skull. I lost hearing in my left ear, so I don't have hearing at all.
Hmm.
And that was probably the rock bottom. And
It was a
What
rough time.
yeah, that was a rough time.
was that
And
before you guys came to North Star?
that was before.
Absolutely.
Yeah.
Yeah.
Yeah, that was in 2013.
Yeah. Matt has never given up. And even when this happened, it was, and I know there are vets listening and they're really, really struggling and they really think that there are no options. And Matt was really at a point where he was like, there's no options. And that was his solution. And so, yes, it was bad. And luckily I was there. But if for anybody that is feeling suicidal, you got to get help.
Absolutely.
It is painful for the family. It's for the children. This is, there is a way to go about it. If
Right.
and yes, the emergency rooms are, they're a busy place, especially post COVID, and the nurses are fatigued, but you just got to go in and you have to say, I am thinking about hurting myself.
Please help me.
Somebody's got to stay with
Yeah,
me.
just do something. You gotta. There's new technologies. There's hope. There's
Mm-hmm.
always something. There is a way. So
And
you know,
don't be ashamed.
yeah,
Like, forget those people. Like, forget about it. Forget what your family's gonna think, your friends are gonna think. Just do the people a favor that love you. And I know you're not thinking about that, but just walk into an emergency room, go straight to the crisis response center in your neighborhood, and just say, I cannot be alone right now.
Absolutely.
And they just go through the process. Yes, it's gonna suck. Yes, it's gonna be horrible. They're gonna treat you, they gotta treat people, there's people with different conditions. So they put you in this category and they're gonna keep you safe. So you're gonna feel like, I don't belong here. But you know what? At least you're not doing something completely stupid.
Right.
Because there is hope. There is HBOT. There are other things that you can do. And you guys, if you want to talk to Matt and I, call us and we'll tell you the dozens of things that we've tried doing to bring relief to, depression and brain injuries, and these vets that are struggling. But yeah, if you don't know how it works, you either call the hotline or you go straight to a crisis response center. You can call your police station. They can come and bring with you. If you have a family member that you're worried about, that you're saying, I don't trust them, you can do a wellness check.
Right.
You can do have an intervention. We never did that with Matt, but like, now as a healthcare professional, now I know, like, you can call somebody and say, I'm really worried about these people, and there's going to be an intervention, right? The patient, like Matt, would have been so mad, right?
Yeah.
But if you're sitting in a room right now and you're hurting that bad,
Just go get
do
help.
not, I had to see Matt the way he was,
Yeah.
and I'm stronger because of it, and I get to help other people for
Right.
it. But your loved ones may not be able to handle that.
Yeah.
And so,
Well, I am incredibly thankful that you are still here.
me too.
I know you are. I'm sorry that it got to the point where you felt that way. But we are getting close to wrapping up. So I wanted to say that I really appreciate you guys coming today. I genuinely appreciate you sharing your story with us. I know, going back and talking about those things isn't always easy. So thank you for sharing that with us. And I hope you guys have a beautiful and blessed rest of your day.
thanks so much. And we're here. Like she said, feel free. You can get our number or call North Star or Satin or Mondo. Like, we are here to share our
Yes,
story. So
absolutely.
we just
Yeah.
want to help people. And thanks for having us.
Yeah. And then when the vet, when the vets come out of this, they'll also be able to help others.
Yep.
Absolutely.
It's a
And that's
chain
share their
reaction.
story.
You'll be next.
Right? That's right.
All
All
right.
right, guys, take care.
Thank
Thanks.
you.
Bye.